Last but not least, the veins draining the lower limb. So let's remember, here is our inguinal ligament. Here we have our popliteal fossa, and about here we have the adductor hiatus. That's it. Okay, just like when we were describing the veins on, what was the color? Blue, I guess, that we were describing, yes, right? The deep veins of the upper limb. We're going to start describing the deep veins of the lower limbs. It's easier because it has the same names as the arteries of the lower limbs. So let's start on the sole of your foot. So the plantar area is drained, and your toes is drained by several digital veins that drain into a plantar arch. And this plantar arch, don't worry about the names of those veins. The thing is that they empty the blood into this vein that is on the back and medially. So posterior and medially aspect of your leg. What do you think? Which vein is this one? Is the posterior tibial vein. Now, the posterior tibial vein receives blood from a vein collecting the oxygenated blood from the lateral compartment of the leg. Which vein do you think it is? This one? The fibular vein. Now, let's keep going with the posterior tibial vein. The posterior tibial vein receives blood from a vein that is coming from the anterior aspect of the leg. Actually, that vein is also collecting blood from now the dorsal aspect of your digits and form the dorsal arch. And they in here in your foot is the dorsal, where do we put it? Dorsal pedis vein, and ascends in the anteromedial aspect of your leg as the anterior tibial vein. This anterior tibial vein, just like the artery, passes now in the opposite direction. It goes from anterior to posterior through the interosseous membrane between the tibia and the fibula, and meets or merges with the posterior tibial vein. So the posterior receives the anterior tibial vein and form, what do you think is going to form? A vein located right here behind your knee. That's the popliteal vein. And the popliteal vein does the same again. It goes through the adductor hiatus, and now it becomes anterior, and ascends in the anteromedial aspect of your thigh. So this vein in here, we're gonna call it femoral. And as you can see, we're repeating the same arteries, but backwards. And this femoral artery, once it passes under, and I'm going to put that in another color, once it passes under the inguinal ligament, it becomes the external iliac vein. And the external iliac vein receives blood or merges with the internal, this is internal iliac vein. And let's just label that the other one so we're clear. This is the external iliac vein. Both the internal and external iliac vein form the common iliac vein. No more CIA anymore. And right and left common iliac veins form, I'm out of colors, black, form the inferior vena cava. Vena cava. And that's, okay, how the deep veins distribute in the lower limbs to form the inferior vena cava. But we're missing one part in this picture. We're missing the superficial veins. And these superficial veins are draining now the dorsum of the digits and the dorsum of your foot, and they're going to empty the blood into two main veins. There are only two veins in here in the superficial network of veins on the lower limbs. There's a lot of connections between these veins, but the thing is that we have only two. This is the great saphenous vein, and it's called the great saphenous vein because look, it's the larger vein of our body, and it spans or extends from maybe your ankle toward the inguinal ligament. And on the lateral side, we have lateral and posterior. We have another vein that is the small saphenous. So this is the great, well, I'm going to stop it here, saphenous. And this one is the small saphenous. The small saphenous empties the blood, it will be like around here, lateral and posterior, and merge with the popliteal deep vein. Okay, so that's how the superficial and the deep here and the deep veins are connected. The small saphenous vein empty blood, the small saphenous plus the popliteal form the femoral vein, and the femoral vein plus the saphenous, the great saphenous, form the external iliac vein. Let's see if we can do something similar as what we did in the upper limbs veins. So we have small saphenous, SS, plus the popliteal form the femoral. Okay, the femoral plus the great saphenous form the external iliac vein. The external iliac vein plus internal iliac vein form the common iliac vein. Times 2, right? The right and left common iliac veins form the, not superior, inferior vena cava that will opens into the right atrium of the heart. Ta-da! Okay, let's see that in a better picture. Now, in here, let's identify first the deep veins. Let's start just we were started our description previously in the other slide. So here are the the plantar, the digital veins emptying to the plantar veins, and look, this is the posterior tibial vein. Look how it follow the vein, and is receiving blood, deoxygenated blood from the fibular vein. The fibular, we continue here, the posterior tibial vein plus the anterior tibial vein form the popliteal vein. Okay, now look at this. This is the anterior tibial vein. First, as a dorsalis pedis, ascends in the anterior aspect of the leg, anterior tibial vein, and goes posteriorly to join the posterior tibial vein and form the popliteal. Popliteal receives blood from this superficial vein, which is this one? Wait. Yes, the saphenous vein. This is the small saphenous vein. You can see it in here. Small saphenous vein empties blood or joins or merges with the popliteal vein. Small saphenous plus the popliteal vein form the femoral vein. That it becomes anterior, ascends in the just next to the femoral artery, located actually also in the femoral triangle. The femoral vein receives or merges with the great saphenous now, and both form, when they pass through or under the inguinal ligament, they form well, only this section is the external iliac vein. The external iliac vein plus this tiny one, which is the internal iliac vein, form this section, which is the common iliac vein. This is on the right side. Same thing is happening on the left side. The right and the left common iliac veins, it was not intentional, form the inferior vena cava. Now the inferior vena cava, here we can see one more. Okay, this is which one? External iliac vein. Which one is this one? Internal iliac vein. They merge together. This is the direction of the blood flow. They merge together and form the common iliac vein. And this common iliac vein, on the left side, they merge together to form the inferior vena cava. Inferior vena cava is draining all the blood from all the abdominal organs, abdominal wall, passes through the diaphragm muscle, which is this, through the foramen for the vena cava, passes, gets thoracic. In the thoracic cavity, well, there's more abdominal cavity draining or collecting the oxygenated blood in there. In the thoracic cavity, it drains blood from some of the thoracic organs and also from the thoracic wall inferior to the diaphragm, and empties finally into the right atrium with the superior vena cava and the coronary sinus, ready to start the pulmonary circulation again. So you can go back to the first video in this class, and we're gonna do another cycle, another heartbeat. So please keep in mind that we leave quite some blood vessels out of this class. We just cover and mention the major blood vessels, but we did not cover them all. Okay, I hope you did not end like that, all tangled up in this messy blood vessels. See you in the next chapter. Bye-bye.